Good day everyone. For today's video, we are going to do a initial assessment or what they call the primary survey, and the other one is the cardiopulmonary resuscitation or what they call CPR. So primary survey is a quick way to find out how to treat any life-threatening condition a casualty may have in order of priority. We can use the RABC to do a primary survey that stands for danger, response, airway, breathing, and circulation. When we see someone get injured, the first thing we're going to do is to check for any danger to make sure it's safe before approaching them. Once we have checked that it's safe to approach them, then the second thing we're going to do is to get a response from an injured person by asking them a question. Hello Lance, it's me Frankie. Can you hear me? Open your eyes. If they are not alert and you don't get any response from them, then you have to shake their shoulders gently and ask them a question. Hello Lance, it's Frankie. Can you hear me? Open your eyes. If they don't respond, then you can pinch their earlobe to see if they are going to respond to pain. If there are still no response, then we are going to use the AVPU scale to know the level of response. AVPU stands for alert, V for response for voice, P for pain, and U for unresponsive. If a injured person is unresponsive, then we are going to check his or her airway. By checking the airway, one hand on the forehead and gently tilting the head back with two fingers under the chin. We are now going to check if they are breathing normally by placing our cheek over their nose and mouth, looking down their body to check if their chest rises and fall. We are doing this for 10 seconds. If an injured person is not breathing normally, then call for an emergency help to 0289415854 and bring an AED and begin CPR with chest compression. If an injured person is breathing normally, then I am going to check their circulation. Like, are there any sign of severe bleeding? Then I'm going to look and check down the body. I established that this person is not bleeding. If an injured person is breathing normally, then try to control it and call for an emergency help before continuing to treat an injured person. Always remember that doing primary survey, it is important to obey or to follow the DRABC accordingly. For today's topic, we are going to perform the CPR or the cardiopulmonary resuscitation. CPR is a life-saving method during emergencies. It specifically applies to the person who's having a heart attack or near drowning if in case the person stopped breathing and no pulse or heartbeat. In doing CPR, always remember the CAB, that stands for compression, airway, and breathing. Before starting the CPR, first check the following. Safety of the area for the victim, Check if the victim is conscious or unconscious. Check the vital sign using DRABC and call for emergency number, or the other person will call to emergency number. Kneel down next to victim's neck and shoulder. To do compression, you put one hand in the middle of the chest and the other hand over that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 30. If you haven't trained to perform CPR, it is pretty much to continue what you are doing until the medics arrive or until the person become conscious. If you are trained to perform CPR, you would check their airway by putting your palm on the person's forehead and gently tilting the head back with two fingers under the chin. Check if they are breathing. Place your cheek up to the mouth. If you feel air coming against your face and if you see their chest rising and falling by itself, then they are breathing. And of course, while checking the airway, we are doing this for 10 seconds. We are not just leaving a person breathless. Along with the airway, pinch the nostrils to close, provide mouth to mouth, and seal the casualty's mouth with your mouth. If they aren't breathing, give the first rescue breath and watch the casualty's chest rises. If it rises, prepare to give the second breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27. If the chest doesn't rise, repeat head lift, chin lift maneuver, and then give the second breath. For one cycle, 30 chest compressions followed by 2 rescue breaths. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Continue doing this cycle until they come to or the medics arrive. 29, 30. Performing CPR, it is important to have a knowledge or a training for you to treat a person or an injured person properly. And always remember the CAV or the compression, airway, and breathing while doing a CPR.